Pulmonary embolism usually originates from thrombosis in the deep veins, usually the lower extremities, less likely the upper extremities, that dislodges and lands in the lung. That causes malperfusion of that part of the lung and prevents the exchange of oxygen at the level of alveoli and blood vessels, causing hypoxia, a lot of strain on the heart to push the blood against that obstruction, which strains the right ventricle and sometimes causes the malperfusion of the entire body, causing hypotension and syncope, in addition to arrhythmia and so forth. The combination of all these can be very lethal. Therefore, treatment of this disease has to be timely. And thus, that's bring us to the role of PERT. So, Dr. Abuhalimeh, tell us, what's PERT and why is it important?
Absolutely, that's a great question. So PERT, which stands for Pulmonary Embolism Response Team, is a multidisciplinary team-based approach. What happens is that this brings out different people or different experts from different teams to come down together in order to do a couple of things when it comes to a patient who has pulmonary embolism. One of the most important things is the actual timely diagnosis, as earlier suggested. The other thing is risk stratification of those patients that practically help us to identify the prognosis of those patients and the appropriate treatment for those patients as well. And then the most appropriate modality in order to treat those patients. Should we go for anticoagulation treatment alone, or are they candidates for a possibility of an intervention?
Beyond that, it's not just a pulmonary disease, but it's a circulatory disease. And what kills people in the fastest way is that failure of the right heart. And so those are the factors we're looking at, namely the blood tests of troponin and BNP to see how their heart is straining or not straining, and then looking at some of the imaging factors on the CAT scan, the ratio of the right ventricular size to the left ventricle. And beyond the CT scan, what we're fortunate to have here is a very rapid capability to do echocardiograms. And if we're seeing right ventricular strain on any of those imaging, either the CT scan or the echocardiogram, plus elevated blood markers for the BNP or troponin, that patient is now an intermediate high-risk pulmonary embolism, and that technically meets criteria for doing an advanced intervention.